And now, the moment we've all been waiting for. It gives me great pleasure to introduce our keynote speaker for this evening, Professor Karolina Kublickiene from the Karolinska Institute in Sweden. It's difficult in the short time that I have to really do justice to all of Karolina's lifelong achievements in women's health, but I will do my best to summarize her illustrious career briefly. Karolina is a well-renowned associate professor in obstetrics and gynecology and a senior scientist in the Department of Clinical Science, Intervention and Technology. Karolina conducts PhD courses on sex and gender aspects in biomedical research and undergraduate courses in gender aspects of health and disease. Karolina has a particular interest in women's cardiovascular health, both in the reproductive age and after menopause. She also has a research interest in the implementation of sex and gender in preclinical and clinical research, all of which is focused towards innovation in healthcare. She is the principal investigator for ACT, a Horizon 2020 EU project on gender equality and gender dimension in research. She is also principal investigator for Going Forward, and she is founder of the Gendered Innovation Alliance at Karolinska Institute. This is a platform for knowledge sharing regarding implementation of the gender dimension in research and the educational content, all geared towards innovations in medicine and healthcare. Karolina has her eye on the innovators of the future, and as part of her work, she fosters and encourages students in collaborative and creative initiatives to become the future innovative scientists, leaders, and technology influencers. Welcome. Without further ado, I'd like to welcome Karolina to speak about unmet needs in women's health and the gender dimension.
Is it okay, everything now? Thank you very much for such a nice introduction. And really, best regards from Stockholm now. It's an evening, and it's a pleasure to be here, and congratulations to organizers for this. I also want to stress up that for such a nice, resume that you did about me, I am PI for the Swedish side, so just not taking the whole glory for that. But it's lovely to be here, and I'm happy to share my experience and my knowledge and my vision. So what about the unmet needs of women's health, and what about the impact of gender dimension in healthcare research and technology? And actually, I would like to start about introducing the health concepts, because we're usually talking about the health, but we really also need to know what it exactly means. And according to World Health Organization, health is the state of complete physical, mental, and social well-being, not just the absence of disease or sickness. And differences in health and illness patterns of men and women are attributable both to sex or biology and to gender, that is social factors such as powerlessness, access to resources, and constrained roles. And I think you all agree with me that today global's economy expand health concerns beyond the borders, and we need to focus on personal choices to achieve our optimal health, as well as the health of those around us. And in this case, the research, when we're empowering the patient or individual, or responsible research and innovation, taking, the important and significant role. And here, I representing, and as I will talk about the gender dimension, I will present from helicopter view. You're all aware about the gender equality policy in the Horizon 2020, but gender dimension means integrating the gender in the gender dimension in research content means taking into account the biological characteristics of females and males, which means sex, and the involving social and cultural features of women and men, girls and boys, and I really want to stress an equally important and gender diverse people. So again, why it is important, and I really want, as I talk for all the innovators, that we are now recently launched the Horizon Europe call, and indeed, based on the lessons that we learned from Horizon 20, we know that even, we had approximately 35% of gender-flagged projects we really still appreciate that there are less expected proposals with sex and gender analysis. And it's also the other thing which was evident, that we lack of training on gender dimension or how to precisely to implement sex and gender aspects in the research content, education, and innovation. So be prepared. The gender dimension, together with scientific careers and decision-making plans, will construct, gender equality plans, which will be eligibility criteria to apply for Horizon Europe goals. So to understand this whole process, I want to simplifyly present, how we're thinking about the science policy, because policy is one of the drivers of discovery and innovation that can enable sex and gender analysis in science and technology. And you can understand the central point is actually the research institutions or universities that synchronize their policies with the funding agencies and as well as peer journals, really to prepare not only the researchers or investigators, but also the evaluators that are looking at those proposals, how optimally to introduce and implement methods of sex and gender analysis, because we want to have a proper result, to have the reproducible results, to show the inclusivity in the research, to have transparency in research, and towards the optimal knowledge or new knowledge that will be related to innovations. And when we're using sex and gender analysis for discovery, we will have gendered innovation. So at this stage, European Union presented communities of practice that you are presenting now, and this is what it means: collectives of representatives with a shared domain of interest in advancing the implementation of the European research area gender goals. And my sincere congratulations today for NUGAFEM, to being one of the very important COOPs, to implementing gender dimension and sex and gender aspects for innovation in women's health. So congratulations. So what about the innovation? And I think also when we talk about the innovation in this audience, I want actually to remind you what exactly innovation means. And innovation is something original, new, and important in whatever field that breaks into or obtains a foothold in a market or society. And I'm also quoting that, the director of our innovation agency at the Sweden, that indeed innovation, in the sense of radically improved technologies, products, businesses, and working methods, is about more than competitiveness. It is an existential issue for our generation to come. At the Karolinska, we have the vision for the, at least, Gendered Innovation Alliance, that we truly believe that sex and gender and diversity in the research and educational content will be the new normal. And I will share with you some, framework that how we are working. And for more information, you can go and visit our website. But particularly for the gendered innovations, we truly believe that we should have, the 4-pillar model where academia, industry, healthcare, individual working together to get the most optimal and most, valuable innovation in the healthcare and for the medicine. So what about, innovations that are transforming medicine and healthcare? And this is just, the summary of the recent reports, what it is important. And here, of course, sex and gender or gender dimension adds value. And I think we're going to hear today more, but we can say about the pain management, regenerative medicine, handling the big data, precision medicine, single cell analysis. I really recommend to go and look at those. And also considering sex and gender aspect, you will improve and get the gendered innovation. And for this reason, I also say that the initiator of the genderless innovation is very close friend and mentor for me, Professor Londa Schibinger from Stanford University, really now together with the European team produced Gendered Innovation 2 policy review, how to include, sex and gender aspects and how it contributes to research and innovation. And of course, if you look in the medicine, sex and gender bias in research, medicine, and healthcare is expensive by terms of lives and costs, limits scientific professional creativity, excellence, and benefits to society. It as well limits business opportunities and in-depth understanding of diverse gender needs, behaviors, and attitudes. And it's usually for the students and to everyone in audience, we're giving a business case which shows that within the 3 years, 10 drugs were withdrawn from the United States market because of the life-threatening health effects. 8 of those showed greater severity in the woman. And of course, there are tremendous costs up to $5 billion, dollars to develop, to new drugs. And of course, if you're doing science right, you're really saving the lives. And I truly believe that including sex and gender as research variables brings down costs, promotes discovery of the disease mechanisms, and saves lives. And this is the wake-up call. This is really a wake-up call or stress test for our scientific community and our innovative, because this is a real-world example where the gender dimension is needed. And COVID-19 reinforces the importance of sex and gender across the research spectrum. Here you can see the simplified figure, which shows that indeed for this virus, there are receptors, which is actually located on the female chromosome X, and where the other receptor is regulating by hormonal environment. We know that males have more severe symptoms and more likely to die from COVID-19. On the other hand, women represent 70% of the global healthcare workforce and are more likely to be infected by coronavirus. And gender is a risk factor for intimate partner violence, higher risk, and mental stress due to the COVID. The important note is this publication, it is not published yet. However, it was half a year ago where, in June, and actually 11 clinical trials were already published. But indeed, those 11 clinical trials in scientific journals, and they indeed have not done sex disaggregated results. And to be honest with you, I don't think that in current, age and in current scientific community, and we can appreciate and accept these results. And the matter is, it's not only important what kind of research are we doing, that we're involving, the sex and gender dimension. The gender dimension or, the content in our research goes hand to hand with other important gender equality issues, like the career progression and decision-making. And if those processes are impaired, they also affecting, the research quality. And I also want to stress that in medicine, we're all aware that women integrate more gender and sex variables into their research and improving its relevance for all. However, what the COVID pandemic showed for us, that the gender gap before and during the pandemic even more increasing, and COVID-19 has amplified the persistent gender inequality in academic medicine. Because indeed, during this pandemic, the first and the last authorship, presentation for the women decreased. And as well, we're all aware that women represents only a quarter of COVID-19 experts in the media and a quarter of the members of the national task. So it's not only the content for the gender dimension, it also has to go hand to hand with the gender context, which presents, the gender equality in the decision maker and in career progression and the gender budgeting. So we need to do better. We need to do this together. And how we can do that? We could educate, we can embrace the knowledge, communicate, embrace overall diversity. And we do have a momentum where we can use this twin approach for the content and the context. Education at all levels. And this is a very simple example from Swedish students, where it shows that doctors treating patients differently is a reminder for all of us about implicit bias. And this is a simple case for the medical students at Karolinska when they're getting, the patient with the similar symptoms. However, one patient is the woman and the other the man. And the outcome is that woman gets less investigations and more psychopharmaceutical drugs. And men, less of psychosocial diagnosis, less psychopharmaceutical drugs, but more tests. So we have to appreciate our bias and learn from there. And of course, we're all aware about the bias even against the female teachers. And we know about the gender of experimenter has a significant effect on a range of variables. So, are women more complicated than men? Of course we are, because of our biology, and this is undeniable reality. Women have more complicated physiology surrounding their reproductive capabilities, and indeed, it will affect quality of life, neurological health, cancer risk, cardiovascular, and reproductive health. We have a lot of advancement, after implementation of Women of Cardiovascular Health, and I only shortly will summarize that, after our initial presenter, that indeed, implying sex and gender aspects, we have gendered solution or gendered innovations in women cardiovascular health. And indeed, analyzing sex has led to understand that heart disease in women often has a different pathophysiology if compared to men, particularly in young adults, has also led to new diagnostics techniques and better symptomatology. And of course, analyzing gender has led to increased understanding of risk factors and prevention. My passion is to understand how the reproduction or the pregnancy affects, women's cardiovascular health. And I think those which are in field will agree that previously accepted, assumption that cardiovascular risk increases only in women when they are after menopause is actually questioned. And now we're looking for women's cardiovascular risk as a lifelong process because it's affecting, even starting to affect during the intrauterine development, infant life, when you have the pregnancy, of course, menopause. Thank you. So actually what is happening, we have, now evidence that adverse pregnancy outcomes affects premenopausal women and increases risk for the number of cardiovascular disorders as well. If you have the severe adverse effects like severe preeclampsia accompanied by preterm, delivery, you have even double and more increased risk that suggests that women after pregnancy at premenopausal age should be, followed up and also considered for intervention. Very shortly about the absence and failure to include more women in the clinical trials. And here I suggest you to look for our recent publication about the age, sex, and drug trials in women. And this is important, to include more women, because we know that there are 6 differences in pharmacokinetics and pharmacodynamic actions related to the drug absorption, distribution, metabolism, and elimination. And this is extremely matter for the future development. As example, we know now that actually the chronic pain in males is mediated by different cells than in females, suggesting that male mice cannot be used as a proxy for females in pain research and drug development. However, the current aspects, including in the neuroscience, you can see here in the publication 2017, we still have, those green bars that in publication, sex is not considered as a variable, and we need to do better. And we need to also to think, how to help, for the researchers, because in academia we have publish or perish, and whether we can support to do research, including both female and male animals or the patients. We are doing better. This is the list of the papers which are requiring and informing the authors instructions how to include sex and gender. It's also, if to look for each cell which has sex, and actually the cell, depending on the sex, behaves differently. However, we again need to do better because this is the later publication using the biomaterials where you can see that in this case, commercial primary cells, isolated cells, or all cells in these papers are not representing and not reporting the sex of the cells because it's matter how the signaling is coming, and how it could be translated to the disease models. It is important for the cell replacement therapy because the female cells and male cells regenerates differently, and it has effect on the clinic, for example, for the blood transfusion and survival after cardiac surgery. So I'm really pleased, to give for you this talk today, and medical science needs your involvement. I think, with this short presentation, I convince you that gender dimension helps, for better health. Use gender lens, be gender sensitive. Use sex and gender statistics for gendered innovations. Spread the word, push boundaries, and be the leader that other follows. And the good concept that you have is extremely important and should be supported in future. Diversity adds value for innovation in healthcare. This is about you. This is about your families. This is about your friends. So get involved, and one day the world will thank you. Thank you very much for your attention.
Thanks so much, Karolina.